So Cassandra, take us on a visual journey of your typical day in the clinical field.
Well, a typical day began at about 9 a.m. where Carol and I would meet for pre-conference, and we would discuss the patient's illnesses and review their past visit history, just to get an idea of where we should focus for the day. Once we entered the patient's home, we would obtain consent to do a physical assessment and obtain vital signs and do a review of systems. My physical assessment almost always focused on heart and lung sounds and assessing the patient's extremities for adequate circulation. And then we would also do what we call a pre-pour. A pre-pour is when we pre-fill the patient's weekly pill boxes with a 2-week supply of medication. And at this point, we would discuss with the patient any side effects that they may have had with the medication or any discomforts that they had pertaining to the medication. Then there were other typical days that included all of those things, but also wound care. And during wound care, we would clean the wound and measure it to assess the progress from week to week, and also apply the appropriate wound healing agent.
So can you tell us the kind of neighborhoods that you serve?
We serve patients in the Bronx community, areas such as East Tremont, which is located in the Southeast Bronx, and also areas in the Northeast Bronx, such as Boston Road. And the patient population was comprised of 2 minority groups, including 43% of Blacks and 53% of Hispanics.
Okay. So can you tell us some of the most common illnesses of this patient population?
Hypertension and diabetes, definitely. Okay. And most of the time, a lot of the patients had both.
Okay. So Cassandra, tell me one of the most memorable moments of your whole entire clinical experience.
The most memorable would have to be the day when we were standing right in front of the patient's door and Carol gave me her computer. Normally she does all the computer work and I just look, but this time she handed it to me. So I'm looking at her like, what's this about? And she's like, yeah, you're going to conduct the whole visit by yourself and I'm going to just watch. And I'm sitting there and I'm like, oh gosh, I'm nervous. And I'm like, this is unfamiliar territory for me. So I went in there and I did what I had to do. I did the physical assessment, my review of systems, I obtained my vital signs, of course, my wound care. And upon doing my pre-pour with the patient reported not taking her medication, her blood pressure medication. And I kind of looked at Carol for her to chime in and kind of help me educate the patient on, why she needed to be taking that medication. But Carol gave me that look like, no, you're going to do this. And I kind of just knew that she was giving me full autonomy in this experience. And I was so grateful for it. But I was so nervous, but I realized that I would have to use my own critical thinking skills and rely on those as opposed to having her there as a resource person. So I was my own resource person and I came up with an effective way to deliver the message to the patient. And it ended up being effective because the patient did agree to taking the medication and she did verbalize the importance of taking the medication on a daily basis.
Good. Did this experience allow you to meet Bloomfield College's core competencies?
Yes, actually, I met all 8, and but there were 3 that kind of just stuck out to me, which would be the problem solving and critical thinking skills, which is something I've discussed with you, and also my professional skills. Because of my communication skills being enhanced, I was able to build interpersonal relationships with not only my patients, but also with their families and with the VNS staff. Oh, and also information literacy, which is where I was able to assess the needs of the patient population. And I realized that the patient population needed something to refer to when the physician or the nurse wasn't readily accessible. So I created this educational brochure that I have here, and it's on high blood pressure. You can take a look at that. And it pretty much focuses on lifestyle modifications and risk factors and the importance of adhering to your medications.
Cassandra, I noticed that the font of the brochure is really big. Is there a reason for that?
Definitely. I'm dealing with a population aged between 65 and 100. So, most of these patients have problems with their vision. Okay. So, I wanted to ensure that they could see it.
That's great. What are the qualities that made your preceptor, Carol, a good preceptor?
Definitely her wide knowledge base, but more importantly, just her sense of her enthusiastic spirit. And she was very non-judgmental, which fostered an environment of learning, endless learning. And I appreciated her so much for it, because there was never a time when I felt fearful that she would call me stupid because I asked what we call dumb questions, or she would reprimand me.
Okay. And last, what is the one thing that you will take away from this entire clinical experience?
I would have to say that it has taught me to be proactive and taught me to kind of go out of my own comfort zone, and dealing with this particular patient population has really showed me that I may want to take my career in a different direction. I wanted to work at New York Presbyterian. That was my dream. I mean, it still is. I'd love to work there one day, but I'm thinking about taking my career to an area that's underserved, where nurses just don't want to go because of the kind of neighborhoods and the patient population that's there.
Yeah. Okay, well, thank you for sitting with me, Cassandra. Have a good day.
Thank you.
How was this precepting experience for you?
I must say that I really enjoyed the experience, and it just brought out one of the fact to me that I love teaching. I like teaching when I'm working with my patients and everything, and with working with Sandra, who's a new student, I just found it very interesting and exciting just to be able to watch her, take what she's learned from the books and then actually put it into practice on a live person.
Have you seen any growth in Cassandra from the beginning to the end of the preceptorship?
Yes, I can definitely say I've seen growth. One of the areas that I can say she has grown in is her level of confidence. In the beginning, she went in and she was doing different skills, but I can see she was a little nervous, which is expected. But as time went on, she felt more comfortable as far as giving injections. When she was doing wound care, she was more precise and more relaxed.
Is there anything that stood out from this experience that you will remember?
Yes, the main thing I will remember is how basically as Cassandra went into the patients, they were very open to her and welcoming her. I would tell them that she's a student, that she's learning, and they were, willing to have her come and perform the skills on her. And I think the fact that she was received and everything by the patients, that also made her feel confident. And then just the fact that her skill levels, you could tell that she had learned and was able to then put it into practice.